Okay, so I did not come up with this idea. Full disclosure, I have seen this a couple of times on Instagram, and I really wanted to make one for my own patients and for when I go and do talks about birth preparation or birth healing. And so I finally made it. And it's really neat because it shows you how they do a cesarean section. Okay, so the first cut that they make is going to be in the layer of skin. Then they're going to cut through the fat tissue next. Then they're going to get to the fascia, which is kind of a thick fibrous tissue. And that leads to the rectus abdominis muscle. So they don't actually cut rectus abdominis, they sort of separate rectus abdominis to get to the next layer, which is the peritoneum. So this is kind of a connective tissue layer. It's a thin layer that covers our organs in the abdominal cavity. So they cut through that. That's a vertical incision this time. The other were horizontal. Then they get to the uterus and they're going to make a small cut in our uterus. Here's the bladder. So they kind of pull the bladder out of the way. They're not cutting through your bladder, hopefully. Then from the uterus, they make a little incision in the amniotic sac, and there's baby. And then they pull out the baby. And so that's a lot of layers that they're going through. And you can kind of get all the way down to the bottom, and you're not going to be able to see this very well, but there's baby. So it's a big surgery. It's a big deal. It's not just a quick make a little cut, pull out a baby, and you're done. There's a lot of layers. There's a lot that is disrupted, and anytime you have an abdominal surgery, it can be a challenge for your body to recover, and we don't typically get much time to recover or much education about how to recover. So even though they're not cutting into your muscle necessarily, all of these layers, this is all going to impact how the muscles work, and that's if you heal really well. That's without complications. So I encourage any woman after childbirth to find a specialist just to get a little help. But certainly after you've had a cesarean birth or a perineal tear, you really should find a therapist and get checked out. So skin, fat, one more time, fascia, rectus abdominis is gently pulled apart, peritoneum, uterus, amniotic sac, and that's baby. He looks kind of like a monkey, but that's okay. Forgive me. Isn't that really cool? Y'all let me know if you have any questions, and I hope that was really informative, because I know that before I had my cesarean section, I certainly didn't know that's how it was done. Thank you so much for watching, and I'll see you next time.